Hi, I'm Joe Calderoni, Senior Vice President for Communications here at Mount Sinai South Nassau. Welcome once again to another Facebook Live event. We've done more than 24 of these Facebook Live events since the pandemic began. I want to welcome everyone. We're currently broadcasting from our triage tent right outside of the entrance to the emergency department here in Oceanside. With me today, once again, are our two leading experts who have been on the forefront of this fight against the COVID-19 virus since the very beginning. To my left, Dr. Adhi Sharma. Dr. Sharma is our Chief Medical Officer here at the hospital, and Dr. Glatt. Dr. Glatt is the Chairman of the Department of Medicine and also our Chief Infectious Disease Officer. So I want to get right to it because we already have a lot of questions. I will just remind our Facebook audience that we are going to take your questions. We already have some of your questions that you sent in previously, but just write on the any questions that you may have, just write on the comment section, and we are monitoring those, and we will have time to get to them later in the broadcast. So there's an intense focus right now, as we are all very aware, on the vaccine and the vaccine rollout. And I think a lot of people are experiencing some serious issues with how they get the vaccine. That seems to be the number one question of the day. How do I get the vaccine? We know that it's now, according to New York State guidelines, now those 65 and older are now eligible. But it seems like people are having a very hard time navigating the website and also just making an appointment. Dr. Sharma, can you address that?
So earlier this week, the Department of Health website did crash. That may be a function of how many people were trying to get on at the same time, and so people who experienced that this week may have thought it was a source of frustration. I will say for the several weeks that we've been doing vaccination now, several weeks that we've been doing vaccination, we have been having community members able to access appointments through the website. So for the most part, by and large, it has been working. I understand their frustrations. And the challenge has been New York State only gets 300,000 doses a week, and so they can only plan to get so many doses out to the public. Right now, my understanding is appointments are out in March for the Jones Beach, and so I can understand people may be feeling that that's frustrating. We're going to start bringing pharmacies online. We're going to start bringing clinics online. CityMD is going to go live today. So there will be a slow growth over the next 2 weeks of options. And I think appointments will become much more readily available.
So it really is a question of the demand outstripping the supply. That's really where we are right now.
It's our biggest limitation. Even here at the hospital, we were given X amount of vaccine. We've exhausted all of it. So we don't have any more first dose vaccine. What we have now is in reserve for those who got vaccine. Get their second dose. That's what we have.
Simply put, we can't distribute what we don't have.
That's the best way to put it.
So, advice again to the members of the public who are frustrated, and we understand their frustration, they should not call the hospital seeking.
They won't be able to, there's no vaccine to give. So yes, I think their best bet is to keep an eye out. The website does have an option for you to follow the website so that they'll give you updates and you'll get sent messages from the DOH, so that's probably the best way to do it, to stay in constant contact. There are county websites, and there are specific websites like CityMD, and they have a specific website set up. So I would encourage people to use all resources, and certainly certain days appointments become available that they weren't available before, and so you'll figure out the pattern. Tuesdays are a good day for the county website, etc. So that's an example. I don't know that that's the case, but that's what I've been hearing.
Even when we do get vaccine supply, hopefully we will get a resupply, you still have to go to the Department of Health website in order to make an appointment.
So depending on how the supply is distributed, the registration is typically done through the DOH website. So beginning next week, they're allowing other sites to use their own registration process. So that may change very shortly.
Okay. So, again, I just want to emphasize this again, and I'll go to Dr. Glatt. I'm 65 or older. Can I just come down and stand in line at the hospital?
So, no, you cannot do that. What you'll do is be very frustrated because you won't be able to get a vaccine that way.
Okay. And if I have a pre-existing condition. We've heard a lot of conflicting information, actually. I heard yesterday that New Jersey is opening it up to smokers. It seems like different states almost are having different requirements. What is the requirement, Dr. Glatt, right now in New York State? Is it just 65 and older, or is it 65 and younger if I have a pre-existing condition?
So if you asked me that question before 1 o'clock, I would have told you a different answer. I just got off a New York State Department of Health call, and they showed a slide saying that New York State is going to release later today. I don't know that for certain, but that's what the slide said, that's what the speaker said from the Department of Health, that the New York State will, similarly to what New Jersey did yesterday, open up the potential for getting vaccinated to people under 65 who have certain underlying conditions. That was a presentation that I just heard about a half an hour ago. Unfortunately, I don't have more details about that. The speaker stated that there will be information coming out possibly later today, maybe tomorrow, that will outline what are the criteria for somebody under the age of 65 who has significant underlying medical conditions, what those conditions will be, and how those people will be able to access the vaccine, getting the vaccine as well. It's too early for me to say anything, obviously, but I do think that there is a medical need for those patients. And I would stress to everybody, we hope that we'll have enough vaccine for everybody in the next months, plural. We don't have enough vaccine or the ability to give it to everybody today or tomorrow. And people need to still make sure that they're practicing how to stay safe and healthy while they're all waiting to get their vaccine. We hopefully can distribute the vaccine to the people at greatest risk, such as people above the age of 65 and people younger than 65 who have significant underlying medical conditions.
Okay, but at the moment, we're waiting for more advice.
I don't have more advice other than this call. I just came off from the state.
Okay, very good.
As
Right
of
now,
this moment, we're filming this, it's 65 and older or in a healthcare worker category.
okay. And overall, we need people to urge patience, right? Patience is what we need right now. We're pretty certain there will be more vaccine on the way, but we need to wait for that to happen. So, Dr. Glatt, let me stick with you for a minute. We've had a lot of people of childbearing age, women of childbearing age, who have expressed reservations, concern. Is this going to affect my fertility? Could it affect my baby if I am pregnant? Would you address some of those concerns, please?
Sure. So these are very important concerns, and I understand how difficult it is for people to take upon themselves something that they're putting their babies at risk for. I understand that. I want to stress to people that you're taking far greater risks with getting COVID and your baby, unborn baby, future baby that you're nursing, far greater risks to everybody if mommy gets COVID than if mommy takes the vaccine. We don't have any evidence, there's zero evidence that this vaccine is dangerous in causing infertility. We have evidence that COVID could possibly cause infertility, and certainly COVID can cause illness that can make you never have children because you're unfortunately not alive. We have no evidence whatsoever that this could harm a baby inside. There's not even theoretical evidence. The messenger RNA, the vaccine technology, doesn't cross the placenta. So therefore, there's no reason to think it should harm the baby. It doesn't integrate into your DNA. It doesn't integrate into your RNA. It has the name messenger RNA. I wish they called it eRNA, for email RNA, because what it basically does is it sends a message to your protein builders in your body to build the antibody that will be very, very protective. I want to stress to all women of childbearing age who have this concern. I understand the concern. I was on a panel with Dr. Feinberg from Northwestern University. She sits on the American Society of Reproductive Medicine task force on this. They unanimously voted that it should urge to give it to pregnant women. These are the gurus in the field. American College of Obstetrics and Gynecology says it's absolutely not a contraindication if you're pregnant. There's no reason to think that this causes infertility. It's out there on the internet, but there's no evidence for it. And
We
in
had
fact,
one-
there's evidence against it.
One person who sent in a question, I believe I'm getting it correct, who said, but how do you even know this? There were not pregnant women in the clinical trials. So how can you say this?
So clinical trials are designed by lawyers as well as by doctors. And they don't allow initially in many studies for pregnant women to be enrolled in the studies. Despite that, there actually were 23 women in the studies who got pregnant. In the placebo group and in the control group, 11 and 12. There were no adverse effects reported. There are 44,000 plus women in the United States alone who were pregnant and had COVID. The same antibodies that we're talking about generating through the vaccine are present in those 44,000 plus women. And no adverse reactions were reported from any of those antibodies, and no specific complications were reported. But we do know that women who have COVID have a higher rate of intubation, a higher rate of needing a tube put down to breathe for them, a higher rate of medical complications, a higher rate of being hospitalized.
So they're at risk.
They're at great risk. So you're taking a real known risk versus a theoretical potential that doesn't really have good theory behind it. It's a clear-cut decision to me.
Dr. Sharma, I'm coming to you next, but real quick, lightning answer. There's no live virus in the vaccine.
There's no virus at all. Not live, not attenuated, which means weakened, not dead pieces of virus. We bypass that. That's the beauty of this vaccine.
Okay. Dr. Sharma, we've inoculated thousands of both our own staff members here at Mount Sinai South Nassau and also the first responder EMS community have been coming to our hospital since December 23rd, I believe, to get their inoculation. I know we haven't done any academic studies, but anecdotally, have we had a lot of adverse effects?
We've had no serious reactions, not one. We've had some people get a little bit of lightheadedness after the shot. That might have been associated with the needle, and that was maybe 2 or 3 people. Other than that, most people complain about soreness at the site of the injection. A few people have had some low-grade temperatures, some chills, some body aches, and some joint pains, but nothing really severe, I would say. We've been fortunate that we had about 5,000 people vaccinated and not seen any real problems, but we've given out almost 11 million doses in the country, and we're not seeing a significant number of serious responses.
All right, so let's project a little bit. Months down the road, we're through the spring, we're into the summer, we've had a successful vaccination program. I got my first shot, I got my second vaccine, it's a month later. Maybe we get to that magic number of between 70 to 90% to herd immunity. Do I still have to wear a mask, Dr. Sharma?
Once we get to the point where we think that the majority of the population has been vaccinated, the guidance will come out from both the CDC and the federal government as to what activities will be safe to do with a mask and what will be safe to do without a mask. Right now, until we reach that point, it's important for you to realize while you may not be susceptible to COVID after you're vaccinated, we don't have enough information to say that you're not a carrier if you are exposed to COVID that might affect somebody who's not vaccinated. And that's the big concern. So, as an abundance of caution, we're recommending people to wear masks while they're vaccinated. And then as we vaccinate the rest of the U.S. population, decisions will be made regarding having more science, more understanding of what the vaccination does for the carrier status, what activities will be able to conduct with and without vaccine.
So Dr. Glatt, I just want to hit that point again because it comes up repeatedly and I think a lot of people are confused about it. I got the vaccine, I got my second vaccine, I'm a month after my second vaccine, my antibody should be at full power, but it's possible that I could still be a transmitter of the disease?
We don't have enough information. The answer to that is yes. It's a possibility. Just like we know that a significant portion of the people who transmit COVID right now have no symptoms themselves. The concern is that you could possibly take the vaccine, prevent yourself from getting sick, but have a silent infection, and therefore you could be a carrier and transmit it potentially to somebody else. We'll know more about that probably in a couple of weeks, a couple of months, when we gather data and show that that's either not true or that unfortunately it is true. You also have to remember that the vaccine is great. Great is defined as 95%. That means that some people are going to get COVID, albeit they hopefully get a much milder form of COVID. But they are definitely contagious in that situation.
Okay. Again, another reason to keep wearing your mask, keep adhering to social distancing, even after you and members of your family get the vaccine.
But hopefully that will change, but not right now.
Okay. Dr. Sharma, I know that a lot of effort, since we're in this tent and right adjacent to us is an infusion tent where we've been administering antibody infusion treatments to patients who fit a certain criteria, who have not yet been hospitalized, as a way to try to keep them out of the hospital. Just speak a little bit about that. What are we doing in that tent right behind us?
So right behind us, we're delivering what's called monoclonal antibody infusion. So these are synthetically generated antibodies to COVID, to the virus, and they found that this will be a good treatment early in the course of the disease.
These are man-made.
Just synthetic, yeah. And they're early in the course of disease, whereby the patient isn't severe enough to be in the hospital, but they do have significant symptoms, and they have other risk factors that would make them at risk for developing severe COVID. We've done 178 infusions since we started the program, and we've had very good success with regards to the feedback we've gotten from those patients. Many of them tell us immediately, the day after, that they feel much better than they did when they came in. And we're very excited that we're able to offer this, and we want to continue to offer this as long as we have doses available.
Great. So, Dr. Glatt, I think we're now getting to the point where we're going to start taking some questions. And as I said, we already have some questions that our audience sent in. Thank you very much for your questions. Dr. Glatt, any difference between the first vaccination and the second? Is it the same?
It's the exact same vaccine. We strongly recommend that you get the same company that gave it to you the first time. If you got the Pfizer the first time, you get the Pfizer the second time. You got the Moderna the first time, you get the Moderna the second time. It's the same dose, it's indistinguishable. You don't want to mix and match. And when the AstraZeneca or the Johnson & Johnson vaccine comes on board, stick with one vaccine. It's a 2-dose vaccine.
Okay. And how long does it take for your body to build immunity? I get my first vaccine, I can go out to a restaurant, I can do whatever the heck I want. How does it work?
No, so you shouldn't do that. First of all, we recommend that you continue masking, distancing when you do have both doses of vaccine on board. But certainly, you get no immunity whatsoever in the first 10 days, until the first 10 days. In the study, it showed the same exact incidents occurred with the sugar pill, the sugar water vaccine, and the real vaccine for the first 10 days. No difference. In about 10 days, you can start showing very significant levels of antibody, and you definitely get protection from that point on, and you'll get the full benefit and protection when you get your second dose of the vaccine, and then some additional time afterwards.
All right, very good. Dr. Sharma, another question from our audience. Thank you. So if I get the first dose, and then I get exposed and infected before I get my second dose, am I going to get sick?
So statistically, you're probably not going to get sick. Again, this would have to be 10 days after the first dose. And if you do get sick, it will likely be a milder dose. There's no guarantee after the first dose that you'll have the same amount of immunity as you would with the other dose.
All right, Dr. Glatt, again from our audience, thank you for sending in your comments and questions. We appreciate it, Dr. Glatt. I take a blood thinner. Can I still get a vaccine?
Yes.
Okay, that's a definitive answer. Dr. Sharma, we've heard anecdotally about this. I have allergies. What should I do? Does that eliminate me from getting a vaccine?
So most people with allergies can get the vaccine very safely. We want to be cautious with people who have allergies to other vaccines, because if they have a history of allergic responses to vaccination, that should be something that they bring up. Patients with severe allergic reactions, anaphylaxis reactions, they should discuss it with their doctor regarding the safety of their eligibility to take the vaccine. We have given it to people with severe allergies, and again, we've had no reactions so far. We do prepare if there's something that needs to be done. So it is important that if you do have severe allergies, anaphylactic type, that you are getting the vaccination, you let the team know, and if they want to take a few extra steps of precaution, they can do so.
And this is one of the questions that we ask as part of the screening process, correct? So, but certainly if you know you have a severe allergic history, you should let them know, make sure they're aware. Okay, Dr. Glatt, children, they were not part of the clinical trial, they're not yet getting vaccinated, and yet apparently they can be transmitters of the disease. If we leave them out of the equation, how are we going to get to 70, 90% of herd immunity?
We never want to leave the kids out of the equation. That's our future. So we certainly want to include them. And studies are underway right now. Just like with pregnant women, many of the studies exclude children below a certain age. The Pfizer study has a slightly different 16 cutoff than the Moderna, which is 18 for the emergency use authorization. But studies are underway right now with both of those vaccines, as well as other vaccines in children under the age of 16, under the age of 18. And as soon as we know, and we fully expect it to be, but I don't want to say anything without definitive knowledge, once it's safe to be with the kids, they should absolutely get it as well.
So you mentioned, both of you have stressed that if you get the Pfizer, your second dose should be Pfizer, if it's Moderna, and so on. We're hoping additional pharmaceutical companies will get approval so that will increase the supply. Do I have to go to the same location? Say I get my first vaccine at Mount Sinai South Nassau, must I come back here for the second one?
That's the easiest way to do it, because otherwise what happens is there's no way to reconcile who goes where and then how much second dose to have. So it becomes very problematic for the sites. So the easiest way is if you got your dose at place X, go back to place X for your second dose. They will have an allocation of a second dose for you, and there's no guarantee that another place will have that. Having said that, if the vaccine becomes widely available, then it may not be as important, because once it's widely available, we know that the second dose is available no matter where you go.
And we are hoping, and we've heard, that even pharmaceutical, CVS, they may at some point soon.
Correct, but the important point is they're not interchangeable. So if you did get the Pfizer vaccine for your first dose, you should get the Pfizer vaccine for your second dose. CVS may be carrying Moderna. So we're not going to encourage people to do that. But once large quantities of vaccines are available, let's say Moderna is available anywhere, then they may allow people to go wherever for their second dose, as long as it's manageable.
Okay. So I know this next question, and again, thank you, Facebook audience. Keep commenting. We are reading your comments. We're trying to get to as many of your questions as we can. And this is really, I come back to it, we addressed it at the top of the broadcast. It's the $64,000 questions. When are we going to get more of the vaccine? This viewer asked specifically, when are we going to get more on Long Island? I know neither one of you gentlemen is in charge of the distribution. It's federal to the state and the state to us. Just talk about, do they notify us, or how is this?
Long Island's getting vaccine every weekend. I don't want people to think that we have no vaccine. The hospitals got their allocation, and the state has decided that the community vaccinations will largely focus on the outpatient-facing organizations, such as the urgent care centers, the pharmacies, the clinics. And that's what they're looking to do. Every day they are getting vaccine distributions, but what happens is the way the registration works is way in advance of the vaccine arriving. So certainly that's why it looks like there's no vaccine. There's plenty of vaccine right now. It's just not enough for the number of people who live in a given area. For instance, Nassau County, 1.3 million doses. We haven't gotten 1.3 million doses in Nassau County.
Right. So again, people need to exercise patience. It's coming. It's just not here yet. Dr. Glatt, what about the importance of, we've heard you got to get the second Pfizer shot 21 days. If it's 22, 23, does that impact the effectiveness?
We have to start the whole program over in the country if one person gets it 1 day late. It's very reassuring. The CDC has officially come out. You should try to get it at the assigned time. If you can't get it that day, get it the next day. If you can't get it the next day, get it as soon as you can. They actually make a recommendation that if even you were delayed for weeks to get it, don't start the series again. You don't need 3 shots. Take the second shot as soon as you can when you're supposed to, and if you can't, just take it at the first opportunity you have. So for whatever reason, if somebody can't take it right away, take it as soon as you can.
Better to take it than not take it.
Absolutely.
Get that second shot. And would you talk a little bit about the science? Why do I need a second shot? What's happening inside my body?
So with many types of immune responses, you get a certain level of response the first time you're exposed to it. Then you can get a much stronger response if you get exposed to it again. So what we're doing is essentially priming the system here. By giving you the first dose, your body revs up. And then when it sees the second dose of the vaccine, it goes into overdrive, and you're now producing a reliable, large potential to make vaccine antibody. That vaccine will make you make antibodies, and if heaven forbid you are exposed to COVID, day one you'll have plenty of armamentarium to fight it off, as opposed to you have to build it up and build it up and build it up.
And anecdotally, we've heard the second dose of the vaccine, sometimes we've seen a stronger reaction from those who have received the second vaccine, but that's actually a good sign. Dr. Sharma, you want to comment on that?
So certainly we are seeing that some people are getting a little more arm pain, a little more symptoms, but again, no severe reactions in the second dose. And to Dr. Glatt's point, this is not the first vaccine that's done in series. Right? So we've been doing vaccines since the 40s, and measles, mumps, and rubella, hepatitis B, tetanus, diphtheria, those are all series vaccines. So we know that giving multiple vaccinations, it strengthens the immune system response, and you can go from a 70 or 80% response to a 95% response rate. So that's why we're encouraging people to get the second dose. It gives you the strongest immunity available with the 2-dose protocol.
Great. I'm going to stay with you, Dr. Sharma, because I know you've dealt with this issue with our physicians who are affiliated with the hospital, and we have many great ones who are affiliated with Mount Sinai South Nassau. When will the doctor's offices get, and will they ever get the vaccine and be able to administer it in the doctor's office?
So there was an application process when the state rolled out the vaccination protocols. Any site that wanted to host the vaccine had to apply. The doctor's offices, all they have to do is apply. And if they're eligible, they have to meet eligibility criteria, they'll get vaccine. What I imagine is that the challenging part is right now they're shipping them in kits of 1,000 doses of Pfizer and 2,000 doses of Moderna. So in order for most doctors' offices to accommodate that, it have to be a pretty large office. And so what they may do is do central deposits and then have it distributed to doctors.
Smaller amounts to individual physician offices. Do you think we're going to get to that point at some?
I imagine if we want to vaccinate the entire populace, we're going to have to be aggressive about vaccine distribution.
Okay. Here's a question from one of our Facebook followers here. Dr. Glatt, what's your advice? If I got vaccinated, can I eat with people who are unvaccinated? Can I go to a restaurant and enjoy a meal with them?
So again, at this point in time, unfortunately, we have to reiterate that we do recommend that you practice the same type of safe practices, masking and social distancing, whether you're vaccinated right now or not vaccinated. Now, obviously, your risk will be decreased, but it doesn't mean because of some unknowns that you couldn't still be a silent transmitter. So for the near future, we hope to gather data on that. For the near future, yes, you still have to maintain the same masking, social distancing, hand washing. Hand washing don't go away. That will still keep for a while. But the masking and social distancing, by getting everybody vaccinated, we have a chance to be able to take these masks off and engage in normal interpersonal relationships like we did previously, sooner rather than later.
All right, Dr. Sharma, say, unfortunately, I'm a person who got COVID, survived. Do I need the vaccine?
So that's a great question. The current recommendation is that we should vaccinate everyone who's eligible to get a vaccine. As long as you don't have an allergic response to the constituents of the vaccine and a strong allergy, you should get it. And right now, with the age limitations. People who've had COVID in the past make their own antibodies, they make their own immune response to COVID that's outside of the antibody response, and are likely the people who need the vaccination least. Having said that, the current recommendation, which varies depending on which day you read it, but we upheld that if you had COVID, you should wait at least 90 days as a general recommendation. It doesn't mean you're not eligible to get the vaccination sooner. You wait around 90 days. And I think, as Dr. Glatt mentioned earlier, as we see the science of this vaccination evolve, and we understand more and more, I think that recommendation will evolve with it, and be roughly able to get, in my opinion, no crystal ball, one booster shot for people who've had COVID. At some point, that will be the recommendation. Right now, if you had it in the last 90 days, you can wait. There's no rush for you to get the vaccination.
Good. And if I had an infusion treatment, can I still get the vaccine?
At this point in time, we recommend also waiting 90 days. And here, there's two reasons. One, you just had COVID. A vaccine will probably not boost your immunity so soon after having COVID. Your body is revved up. But more importantly, the concern is that when we give you these passive antibodies, when we inject in you these monoclonal antibodies, they hang out for some period of time. Your body basically saying somebody else is fighting them off. I don't need to make antibodies, and therefore your vaccine's response in the body, the body's response to the vaccine may not be robust, it may not be good, so we wouldn't want to use a dose in that situation. So the current recommendation from the CDC which I full-heartedly agree with, is wait 90 days after you've gotten these infusions. Again, since you had COVID, you're really not at risk during that 90-day period of time to get a second episode of COVID. So people should be reassured, oh, I'm not getting it, what's going to happen? Chances are nothing will happen to you. It's not 100% clear that you even need to get 2 doses after you've had COVID, and certainly you don't need them in 90 days after you've had COVID.
Okay. Dr. Glatt, I know you've answered this question in the past, but it again comes up, and thank you, Facebook followers, for sending in your comments. We're getting to as many of them as we can. Keep sending them in. We know with the flu, there's a different strain. We kind of follow what's happening in the southern hemisphere, and that kind of determines what strain of the vaccine we're going to develop. Is it going to be the same with the COVID-19 vaccine? Is it going to be an annual shot, first of all?
So I can't answer that with any certainty. We just don't know right now. We have seen more and more frequently in the United States various strains that are different than the strains that were previously. We're talking about the UK strain, they're talking about the South Africa strain, they're talking about various United States strains. There are definitely variations or changes, mutations in the virus. That's normal. This type of viruses always do this. In fact, COVID-19 does it far less than influenza, for example. We can't predict what that will mean in terms of the vaccine. If I can reassure people listening, the studies have been done in the laboratory now showing that the vaccine, at least from a laboratory point of view, should be perfectly still effective against this UK strain. It's a B117 mutation. It's a series of mutations in different parts of the virus, some of which are in the spike protein, some of which are elsewhere. It's technical. You don't have to worry about it right now. At this point in time, the evidence actually supports that it will be effective. The vaccine will be effective. Will that always be that way? I don't know. Will we need to modify the vaccine? We do that every year with flu. It's not a big challenge. From a technological point of view, it's very easy to re-engineer the mRNA vaccine to pick up additional strains. But hopefully that won't even be necessary. And whether we need a booster, I'd love to have this conversation a year from now with no pandemic around and we can debate back and forth, do we need a booster?
You just don't know yet.
We don't know.
All right, real quick, this is a quick one, then I'm going to go to Dr. Sharma. Do I need to wait 14 days to get a COVID vaccine after I receive the shingles vaccine?
So I've been asked this question an amazing amount of times. So the answer is we don't really have any evidence that giving 2 vaccines together like this would be a problem. But because we're so concerned about COVID-related adverse reactions, we don't want to mix it up in any way. So the official recommendation, it's not based on science, it's a good idea, separate the 2 vaccines by at least 14 days.
14 days.
And people should realize if you have a choice of the COVID or the shingles, take the COVID.
Okay.
The shingles one is a very good vaccine, but it's not going to prevent death like the COVID one will. If you don't want to get shingles, take the shingles vaccine. You have 2 to 6 months to take the second dose. If your choice is the second dose of the shingles vaccine or the COVID, take the COVID.
Go for the COVID.
You'll get the shingles more than 2 weeks after that.
Dr. Sharma, I do want to start to wrap up now. Would you tell us a little bit about what's happening in our hospital right now? I think the morning census, we had 100 plus COVID patients in our hospital right now. I remember during the summer, we all get the daily reports. We were down on some days to 0 during the summer. So we've seen clearly the second wave. Just talk to us about what's happening right now. We have the COVID rapid testing going on. We've got the infusion going on. We're doing vaccinations for first responders and staff. And at the same time, we have over 100 COVID positive patients in our hospital right now.
So we certainly are seeing the second surge related to the holiday period, both for Thanksgiving and for Christmas and New Year. It looks like there were a number of events that may have occurred and people were exposed at these events, whether they were household or otherwise, and we are seeing a second surge. It is, projections are that by the end of this week, we should see that number start to decline. We have not seen any indication of that yet, and it's Thursday at this point. So we're very busy. We're taking care of all of our patients. We have COVID units that are designated for COVID patients, and then we have non-COVID units that are designated for all of our other infection patients. And we're seeing surges in both populations right now. So all of the medical disorders, people are still dealing with those. We're here to take care of them, and they're coming to the hospital. Similarly, COVID patients are coming in with severe COVID, and we are taking care of them as well.
We have some people on critical care.
We have a lot of people in critical care. We are managing every aspect of this pandemic. As you mentioned, we're doing the vaccinations, we're taking care of sick patients, we're doing driving testing, and we're doing antibody use. So whatever we can do to stem this tide, we're doing.
So just to reassure people, if you come into the hospital because you need to come in, you're not going to get COVID in the hospital. We're very careful. We actually have systems in place to check every patient coming into the hospital. If they have COVID, we have appropriate isolation for all patients that need it. And if you need to come into the hospital, please don't put off coming in. You have chest pain. Don't say, well, I'll take my chances with the chest pain. Please get medical care.
Right, the COVID patients are on separate units. We've opened up.
They're in separate geographic areas.
There's separate air supplies and there's isolation rooms. If you need to come to the hospital because you have a medical condition that requires you to be seen in the emergency room or to be admitted, please don't push that off.
I just want to go back for Facebook followers who may have tuned in late. I want to just address once again the question of the day. When can I get my COVID vaccine? And where can I get it? And how come it's taking so long for this rollout? So Dr. Glatt, just sum up for us.
Dr. Sharma said it perfectly before. We don't control the flow of the vaccine. It's all federal, which flows to the state. Each state has a different distribution plan. Everybody's working very hard. It hasn't been a perfect rollout. Everybody's working very hard. There's no bad guy here. At the same time, we all need to do a better job. You know, at the hospital, we have an unbelievable staff. They have done a phenomenal job. We don't have any vaccine around. We've given out every dose of vaccine that we have. We'd love to have more. We'd love to give more. More is coming. More is coming.
And Dr. Sharma, I know our staff really is doing a tremendous job, but they have been stressed by all of the things we're doing. We even had to call back retired nurses who were kind enough to come back and help with the vaccination effort. Anything you want to comment about the staff?
Oh, the staff have been amazing. I mean, throughout, from the beginning of March to this very day, our staff have been tirelessly working to help our patients, help each other get through this pandemic. The response of the retired nurses is emblematic of that. They went off into retirement. They thought they were done. They had a need, and they came back. They called us. How can we help? And we're very, very pleased with everything that we've seen with regards to the staff's response. And certainly with the vaccination, as Dr. Glatt mentioned, they've been working tirelessly to get these doses out. We don't want vaccine in the fridge. We want vaccine in the community.
So then I'll just add one thing, because what Dr. Sharma said is so true. It's not only the clinical people, the doctors, the nurses get all the glory. The engineering staff, look what they put together here. And they built vaccination pods, and our facilities people, our environmental people, they're all putting themselves at risk. They're all doing a phenomenal job. So everybody in healthcare is a hero. It's not just the people with white coats and clinical expertise.
This is a very good point. And it's a good point to wind up on. We are planning a public vaccination pod. You want to just talk about where that's going to be, if it happens?
Sure. We right now are in the planning stages of creating a community-facing pod at 519 Merritt Road. That area is currently used for educational purposes. We're relocating, in the process of relocating a lot of the equipment that's used for education there, and working on some of the operational needs for that site to become a vaccine pod. And then hopefully we will open up a large community-facing vaccine pod that will allow us to get to the 1B group, and then the 1C group, and so on.
Very good. So if you're asking yourselves, what can I do to help? One way you can help is please don't call the hospital operator if you're just looking for an appointment to try to get the vaccine. We understand your frustration. As soon as we get the vaccine, we're going to make more appointments available, but it's all through the New York State Department of Health website. That's the only place at the moment, may change, but at the moment, that's the only place that you can make an appointment to get vaccinated. So please don't call the hospital. As you can tell from these two tremendous physicians, we are doing everything we can. Our staff is doing everything we can. But it really does tie up the hospital operator line. So please check the state website first. So I think that's it. I just wanted to quickly add, we've been doing, as I said, more than 24 of these broadcasts. I want to just thank our production crew, Alexis, Mark Head, James Castle, Dana Sanneman, really have done a tremendous job here throughout the pandemic. Couldn't do it without them. Thank you very much. Thank you for sending in your comments. If we didn't answer your comments, we're going to try to do that online afterward. Have a good evening.